Hi everyone, Dr. Emby from Walkaway Back Pain. Today, our first of a three-part series on stair climbing to help with back pain. Today we're going to be discussing how to utilize your glute or buttock muscle and properly stabilize your hip to reduce lower back stress. Hope you enjoy. So continuing our theme in our video series on walkaway back pain, we're going to be using walking as a tool to self-rehabilitate back pain by correcting mechanics and conditioning the lower back. We all walk every day anyway, so why not use walking as a self-management or self-rehab tool to help us get over back pain and to strengthen our ability to stay away from it. Today we're going to be presenting the first part of a three-part series on using stair climbing to help correct mechanics and to strengthen your back against pain and injury. Many times during the day we encounter stairs. It's a great idea, as opposed to just climbing stairs, to put a little thought into the mechanics of how you're climbing stairs to help modify and correct the mechanical stresses that cause your back pain. So today we're going to be talking about using the buttock or glute max muscle more and how to climb stairs and a modified way of climbing stairs to do that. There are many high-quality studies out there on back pain research, regardless of diagnosis, whether you have disc herniations, bulges, degeneration, whether you have spondylolisthesis, retrolisthesis, facet syndrome, osteoarthritis in your lower back, chronic strains. It really doesn't matter, because even sacroiliac pain, mechanics of the back apply to most back pain. Regardless of diagnosis, over 90% of all lower back pain is considered mechanical in nature. Meaning the way you use your back, the way the muscles are integrated, the way you're using the joints, placing stress on discs and joints and muscles and other soft tissues have a lot to do with why you're feeling back pain. And correcting and conditioning faulty mechanics is a great way to address these problems and to get over and put away back pain behind you. So let's walk away back pain today using stairs. Typically, when we step up on a stair, most people have a tendency to have their motion focused on moving forward over the stair, to climb a stair. Many times they will also only use the forefoot and leave the heel slightly or entirely off the stair step, which drives the knee slightly more forward over the toe line. If I were to draw a vertical line up from my toe, as my knee passes it, it weakens my hip ability and puts a lot more stress in my quadriceps of my thigh as I walk up. Many times people with back pain of various diagnostic conditions will have a tendency to have a weak buttock muscle and have the lower back erector spinae that run about an inch or two away from your spine, that run up and down. Those erector spinae muscles, the longissimus and iliocostalis, they overwork and compensate for weak buttocks. As I said, there are many studies that show atrophy of hip muscles in low back pain regardless of diagnosis. So as we walk up a step, if we modify the way we approach walking up the step, we're going to be able to utilize a lot more buttock muscle. Number one, if we take a step and put our foot in as deep as possible onto the stair tread, as opposed to leaving our heel off, and we think about our energy or motion moving upwards as opposed to up and forward, we're going to allow that knee to stay behind the toe line. Again, that imaginary line coming straight up from the front of your foot, your knee should be behind that, and possibly even 1 or 2 or 3 inches behind that. As I do that, my motion now is moving straight up, as opposed to, you'll see the difference, classically forward and up, where my knee is traveling forward more. By keeping the knee in a stable position, once I'm set for that step, my quadriceps work less and I put a lot more demand on the buttock muscle to come straight up. That's an easy way to start utilizing your buttocks more during the day as you're walking, as you're climbing stairs, and over time, repetitively, you're actually going to have a strengthening effect on your buttock, which in turn will reduce the stress imparted to those lower back erector spinae muscles that are usually overcompensating for weak buttocks. Less overcompensation with erector spinae muscles, less compression and extension force on your back, less stress on back pain, less back pain symptoms. Another technique we can use with this is a slight posterior pelvic tilting. Normally, the pubic bone and the tailbone should be level in normal posture. A lot of us have a tendency to have an anterior pelvis where, because of chronic sitting postures, where our hip flexor muscles on the front of our body tighten, they pull the pelvis downwards, where the pubic bone is lower than the tailbone. This has a tendency also to weaken the buttocks and overutilize those back muscles, as well as weaken a lot of the abdominal muscles. So by holding our pelvis in a posterior pelvic tilt position where you rock your pelvis, tailbone under, pubic bone up, and again, just a slight amount is necessary. If you know what your neutral spine or RPI position is, again, that's unique for all of us. That's the safest position we can put our spine, both in terms of pelvic tilting, side shifting, rotation, utilizing different stability muscles. If you're not sure what that is, you can take a free body analysis at painfreeandfit.com and help to find out what your neutral spine and RPI, reverse posture isometric, is. So you can set your spine in the right position before you stair step, walk, or do any exercise. Once we get our RPI set, if we focus on tensing the tail under a little more, not moving it under, but tensing it under a little bit more, we will engage more abdominals and reciprocally relax the erector spinae muscle. If we use this tail under tension as we perform our stair step, it's going to augment that effect of relaxing back muscles so the buttock can contract stronger. Practicing these two tips as you climb stairs through the day, as I said, will help to engage the buttock, help to strengthen it, the glute max muscle, and take stress off lower back tissues. If you like this video on stair stepping to reduce back pain with the Walkaway Back Pain Program, check out our Walkaway Back Pain Program. It has all the self-analysis you need for your mechanics. It has the rehabilitative stretches you can do at home, and a ton of different walking modifications and walking exercises. So you can actually rehab your back as you walk around during the day by knowing what your mechanical dysfunctions are and addressing those with simple walking exercises, all available at the Walkaway Back Pain Program at painfreeandfit.com. Questions or comments, write in. As always, I'll do my best to answer them. Thumbs up to help me share this valuable information with others. And remember to subscribe to our channel if you'd like to learn more of these informational low back exercise videos. I hope this series on walkaway back pain using stair climbing to reduce lower back stress helps you with your chronic lower back symptoms.